So one of the things that we now have embedded in medical culture in this country is the need for continuing medical education. Now, one way of looking at it is that it's a pain because you have to collect a certain number of points every year, you have to log them on the Royal College website, you have to discuss them and show them and demonstrate them at your annual appraisal. The other way to look at it is to say, well, look, I work in a really exciting, fast-moving area. It's what I do for a living. It's right that I'm up to date, and to really embrace it and enjoy it. And that's actually what I've done. And so week by week, I ensure that I am reading all of the relevant journals. So this is Journal of Refractive Surgery, Journal of Cataract and Refractive Surgery, and I, which is the Royal College journal. Also touch on Ophthalmology, which is the American Academy journal. And as with anything, you can skim read, and then you can zoom in on something that you find of particular relevance. So it's important, though, to not just do that reading in isolation. So I can form my own ideas about it, but I'm also fortunate in that I have a weekly meeting with the registrars and fellows that I'm training, and they're so bright and interested, and they're perfect young minds to bounce these ideas off, so that we can establish what we think is relevant, what we think is a meaningful change, and then look at how that's going to impact and change our practice. For example, we do a lot of work on keratoconus in our NHS clinic, and there was some recent research on the impact of corneal rings. The manufacturers had been telling us that there was evidence that the rings stabilised keratoconus, and a more recent publication showed that in fact in younger patients, whilst the rings provided improvement in corneal shape and improvement in vision, in fact there was still a tendency for some of these patients to progress. And in fact, when you thought about it, that did make sense. What we'd done was alter the shape of the cornea, but we hadn't changed the tissue. And we have another treatment for that for keratoconus patients, corneal cross-linking, which does actually change the tissue. So that's just one example, but we are seeing these kinds of sometimes small advancements, sometimes more significant, in every area of my work, so in cataract surgery, lens replacement surgery, and corneal laser refractive surgery. I invite you to please sign up for our course on how to choose a laser eye surgery clinic. It's a framework that will guide you through the steps required to help you make the best possible choice for your provider so that you can receive the best possible care.